Now I will demonstrate alternate methods to elicit the Babinski response. First I will do the classical plantar reflex to elicit the Babinski sign. The lateral part of the sole is stroked from below upwards. Here you can see the extensor plantar response. Now I will demonstrate Gordon reflex. Gordon reflex is squeezing the calf muscle. I have to gently squeeze the calf muscles. Here you can see extensor response on squeezing the calf muscles. This is Gordon reflex. Now I will demonstrate the Schaffer's reflex. Schaffer's reflex is applying pressure over the Achilles tendon. On applying pressure over the Achilles tendon, you can see the extensor response. This is Schaffer's sign. Now I will demonstrate the Strumpel sign. Strumpel sign is applying pressure over the anterior part of the tibia. On applying the anterior part of the tibia, you can get the extensor plantar response. This is Strumpel sign. Now coming to open hem response. Open hem response is applying pressure over the anterior part of the tibia. The medial side has to be pressure has to be applied more on the medial side compared to the lateral side. This is open hem sign. Here we can see the extensor plantar response. Medial pressure has to be more compared to the lateral side. This is open hems. Now I will demonstrate Bing sign. Bing sign is a small prick has to be applied over the dorsum of the foot. On applying the prick over the dorsum of the foot, extensor plantar response can be seen. It is Bing sign. Next, Throckmorton sign. Throckmorton sign is percussing over the metatarsophalangeal joint. First metatarsophalangeal joint. You have to percuss over the first metatarsophalangeal joint. You can see the extensor plantar response on tapping over the first metatarsophalangeal joint. This is Throckmorton sign. Now coming to Stransky sign. In Stransky sign, the small toe has to be abducted laterally and released suddenly. Here you can see extensor response. This is positive Stransky sign. Then coming to Chaddock sign. Chaddock sign is elicited by gently stroking below the lateral malleolus. Here we can clearly appreciate the Chaddock sign. On stroking below the lateral malleolus, extensor response can be seen. This is Chaddock sign. Then Gondas and Allen sign. In Gondas and Allen sign, the second, third and fourth toes should be snapped outwards, or they can be flicked downwards, or they can be twisted and folded for some time. Then we can see the extensor plantar, or the nails, pressure can be applied over the nails. This is Gonda and Allen sign. Then Cornell sign. Cornell sign is stroking over the medial aspect, inner aspect of the extensor hallucis longus tendon. A gentle stroke along the inner aspect of the extensor hallucis longus tendon elicits the plantar sign reflex. Moniz sign. In Moniz sign, the foot has to be passively plantar flexed. On forceful passive plantar flexion, Babinski can be elicited. Here we can see the Moniz sign. Then Allen's and Sheckley's sign. The second toe has to be suddenly flicked upwards. Then we can see the extensor plantar response.